Good morning, everyone. I am going to do a case report on a case of both eye congenital ectropion. This was actually a colloidal baby, which is also known as a lamellar ichthyosis, which is a descriptive term for an infant who is born with an extensed, tight, shiny membrane that resembles a plastic wrap. It is a form of congenital ichthyosis and is an autosomal recessive disorder. The first clinical description of the colloidal membrane was by Press in 1880, which continues to be the valid as the baby's skin is replaced by a cornified substance of uniform texture, which gives the body a varnished appearance. The incidence of this is 1 in 3 lakh live births. There was it is also has congenital eversion of the upper eyelid in colloidal baby was first described by Adams in 1986 and was termed as double congenital ectropion. The condition is usually bilateral, but unilateral cases have also been reported. We are hereby reporting a case of bilateral congenital ectropion in a baby born with lamellar ichthyosis. This is actually the photo showing the child, a baby born at full term by LSCS to a healthy mother, aged 23 years, of a non-consanguineous marriage, was admitted to NICU at our tertiary care center with signs of dryness of skin, scaling, fissuring at places. The baby was diagnosed to have congenital lamellar ichthyosis. On physical examination, the whole body was found to be covered with a parchment-like membrane resembling a colloidon was peeling off from the entire body, including the face. There was slight ecalbum and the mouth was constantly in an open position like a fish. The patient was managed in the NICU with appropriate fluid and electrolyte along with the prophylactic antibiotics. Emollients were advised for skin softening and moistening. So not going into the NICU and the skin part, the patient was referring to the ophthalmology department. On examination, the patient had bilateral ectropion of both upper and lower eyelids. The eyelashes were missing. There was no evidence of discharged corneal opacities or keratitis. The rest of the anterior segment was normal. We managed the patient conservatively by use of hydroxypropyl methyl cellulose 2% eye ointment and lubricants eye drops. Thus, the case was managed successfully with requirement of no surgical intervention. The baby was then discharged, and the 15-day follow-up picture of the baby is here. Now, discussing more on that, the ocular manifestation can be in the form of exposure keratitis, which is secondary to the ectropion, unilateral megalocornea, enlarged corneal nerve, blepharitis, absence of meibomian gland, trichiasis, madarosis, absence of lacrimal gland, ectropion of both upper and lower lids. According to Pankaj Maheshwari et al., the underlying cases of eversion remains obscure and several possible mechanisms have also been proposed and associations have been recognized. Abnormalities, the associations are abnormalities such as orbicularis, hypotonia, birth trauma, vertical shortening of the anterior lamella or vertical elongation of the posterior lamella of the eyelid, failure of the orbital septum to fuse with levator aponeurosis, absence of effective lateral canthal ligament, lateral elongation of the eyelid, have all been implicated as possible pathophysiological factors. Venous stasis during surgery may also cause marked chemosis and the prolapse of the conjunctiva, causing eversion of the eyelids. There is evidence which suggests that ectropion in colloidal babies can be managed conservatively by local application of clobestrol. Ectropion is in lamellar ichthyosis may respond to conservative management in early period of life in about half of the cases. The goal of management is to prevent the desiccation of the exposed conjunctiva and allow spontaneous inversion of the lid. Surgical treatment options include temporary tarsorrhaphy, subconjunctival injection of hyaluronic acid, fornix sutures and full thickness skin graft to the upper lid. The full prognosis of the child is very good if proper care from dermatology, ophthalmology and pediatric department is taken. A comprehensive early management in such cases have shown extremely good result and we are able to avoid surgical intervention. I would conclude with bilateral ectropion is most common ocular finding in cases of lamellar ichthyosis, which is initially best managed conservatively. Topical lubricants and proper patching with regular follow-up is the initial line of management. Surgical intervention is planned only if the conservative management does not give desired results. These are my references. Thank you.
Doctor, first thing I'd like to highlight that your slides. Usually this should not be like as you see in textbooks. It should be point-wise and not more than 4, 5, 6 lines per slide. It is almost as if you have copied paragraphs from text in the initial few slides, if you notice.
Okay.
And secondly, the references has to be put as we see in index journals. It is not like that.
Okay. I'll take care.
Okay, just hold on for a moment. How much follow-up have you achieved in this child?
Sir, the patient belonged to a rural area, so we could attend 2 follow-ups in which we did not find any complication following the ectropion, any corneal opacities or anything.
Okay, so up to how many days follow-up you got?
Sir, the first follow-up was 15 days. We were able to, actually, I was able to see that child. The next follow-up, I was unavailable due to certain, but which I was after a month, and it was good, means there was no any complications.
Okay, thank you.